Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. Understanding fetal position is important because fetal position affects labor progress. We look at the way that the baby is in position based on the back of the baby's head or the occiput. Then we look at the position in relation to the mother's pelvis. So the posterior part of the mother's pelvis is the part that's towards the spine, and the anterior part of the mother's pelvis is the part that's towards her front. For occiput anterior position, or OA, the back of the baby's head or the occiput is at the front or the anterior of the mother's pelvis. The baby is facing the mother's spine. Occiput anterior is considered the ideal fetal position for vaginal birth because the baby's head is able to flex, and this allows the smallest diameter to pass through the pelvis. So we get better flexion of the head where the chin tucks to the chest. The smallest diameter of the head is passing through the pelvis. This allows for easier descent and more efficient labor progression. Occiput posterior, or OP, is when the back of the baby's head or the occiput is at the back or the posterior of the mother's pelvis. So the baby is facing the mother's abdomen. This is going to allow for less flexion of the head, and so the larger diameter of the head is passing through the pelvis. So this can make for more difficult descent and a longer labor. This can also increase maternal discomfort as the bony part of the baby's head puts pressure on the nerves in her back. So if we look at a comparison of these two side by side, occiput anterior is the most favorable and the best position for vaginal delivery. Occiput posterior is less favorable and an increased risk of requiring assisted delivery by vacuum or forceps or even a cesarean birth. Occiput anterior allows for faster labor progression because we can have stronger, more effective contractions, faster cervical dilation, and more efficient pushing. Occiput posterior has a longer labor, mostly because of increased maternal fatigue with the increased discomfort and the slow descent. For occiput anterior, we have less back pain. And then with posterior, we have intense back pain. And with occiput anterior, we have easier fetal descent because of increased flexion. And with occiput posterior, we have more difficult rotation and descent as the baby is progressing through the pelvis. So when we think about how to manage this, frequent position changes can significantly improve mother's comfort and promote rotation from occiput posterior to occiput anterior position. Many babies enter the pelvis in the occiput posterior position and rotate during labor. So position changes, especially in the first 3 to 5 centimeters and beyond, and doing these changes frequently throughout labor are going to help promote rotation and descent. So what positions could we suggest? Hands and knees is one position. Forward leaning over a ball, chair, or pillows. A knee chest position where she actually is forward leaning, but instead of being on hands and knees, we allow the chest to drop down further, and that actually can give a little more space for the baby to rotate because there's less pressure pushing the baby down into the pelvis. A lateral position with an upright thigh flexed. And we can do this either with the peanut ball or with pillows, or we can also do a semi-prone or Sims position. And with this one, the peanut ball is helpful as well. That upward thigh is still flexed up and her body is rotated almost all the way onto her belly, and this gives a lot of space for the baby to rotate in the pelvis. We can also encourage upright positioning to help with descent. So this could be still leaning forward, but maybe over with a ball on the bed or a squatting position, and making frequent changes in her pelvis can help with this as well. Counter pressure on her lower back is going to be helpful for the discomfort, and all of these positions where she's leaning forward gives us a lot of access to provide that. So to review, fetal position affects labor progress. The occiput anterior position is when the back of the baby's head or the occiput is at the front or the anterior of the mother's pelvis. This means that the baby's face is facing the mother's spine. This is going to be our most favorable position, better progress in descent, less pain overall. The occiput posterior position is when the back of the baby's head or the occiput is at the back or the posterior of the mother's pelvis. So this means that the baby's face is facing towards the mother's abdomen. This is going to be a less favorable position. We're going to get less flexion, which can lead to a longer labor and be more painful. Interventions include frequent position changes and counterpressure. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.